Hi, welcome everyone. Welcome to tonight's webinar. Tonight's webinar is on responding to mental health problems. My name's Rosie Barbara. I'm the youth counsellor at Wyndham City, and I have the pleasure of working directly with young people in a counselling capacity and with their families as well. So just going to take a couple of minutes to wait for more of the attendees to join in. We're on time, but I'm just waiting on a few more to join us. As we wait, I'll just let you know that we do have a couple of moderators on standby who are ready to answer some questions you may have. So we ask you to feel free to ask those questions anonymously, and they will do their best to answer those questions. You could also ask questions so that Anthony or myself can answer at the end of the webinar. So we will allow some question time before the end of the webinar. So as we wait a couple of more minutes for people to join, I'll introduce our presenter this evening. His name's Anthony Hurst, and he is one of our youth counsellors as well here at Youth Services, and he also does a fantastic job working with young people in the Wyndham community. So I'll pass you on to him now as I send him live, and and he can take it away. So yeah, off we go. Hi, Ant, you're now live, so go for it.
Thank you, Rosie. Alrighty, I'm going to share my slides up now. Okay, beautiful. Are those up, Rosie? Can you see my slides up there, Rosie?
We can see them, Anthony.
Beautiful. All righty. So welcome everybody to our webinar for tonight. What we're going to be focusing on today specifically is responding to mental health problems. So before we get into things, I'd just like to have an acknowledgement of country. So we acknowledge the traditional custodians of the land on which Wyndham Council sits, and on which some of us are meeting. So I'm aware that some of us will be joining from Wyndham tonight, and some of us will be joining from other areas also. We pay our respects to the elders past, present and future, for they hold the memories, traditions, culture, knowledge and the hopes of Aboriginal Australia. We must remember that beneath Wyndham City, this land is, was and always will be Aboriginal land. Okay, so just to start off with, I'd like for us just to be aware that we're going to be talking about some big things today in terms of mental health. And in fact, the statistics around mental health, particularly at present, would indicate that many of us, if not us ourselves, have all had mental health concerns or know somebody who has had mental health concerns in their life. And so it's really important to note that while we're talking about these topics, it could bring up some uncomfortable memories, feelings or experiences for us. So if that does occur, we've listed some crisis support lines on this slide here. And what I'm going to get each of you to do as attendees tonight is I want you to write down either the phone number for Kids Helpline or Lifeline, whichever feels most appropriate for your age bracket. And the reason I want you to write that down is because if at any point this evening, tomorrow, the day after, anything that we've discussed today doesn't sit right, I want you to have that number there that you can call so that you can access some support. I've also put a couple additional contact details here. So one of them is our youth counselling inquiry email. So we have an online inquiry form for our counselling service, which you can find at that hyperlink sitting just underneath it. And whenever someone submits one of those inquiries, it gets sent to our youth counselling inbox, where we can then take a look at that and process that for counselling. So if you'd like to get in touch with myself or Rosie, you can email us at that email address. What I would let you guys know, of course, is that Rosie and I are unfortunately not a crisis service. And the reason I tell you that is because I would want anyone contacting us to know really clearly what our turnaround time might be in terms of responding to any queries or questions that come to that inbox. So please feel free to contact us there. But if you feel as though you're needing some urgent support or help, please contact one of the crisis numbers that I've listed above. Okay, so our webinar tonight is called Responding to Mental Health Problems. And I think before we move any further forward, we should get really clear on what a mental health problem is. And so what we've got here is three criteria that might let us know that somebody was experiencing a mental health problem. So we have the A, that there's an alteration or a change in thoughts, feelings, or behaviours. The B, that those thoughts, feelings, or behaviours are there longer than they should be. And the C, that these changes our day-to-day functioning and impacts on our ability maybe to engage with education and school, engage with work, engage with friends, engage with family, and the various other areas of our life. So what I really want to differentiate here is what a mental health problem is versus a mental health crisis. Now, the reason this distinction is going to be very important is because it's going to guide what it is that we're going to be talking about tonight. And it's also, aren't we just great marketing geniuses? Because we've got a mental health crisis workshop coming up in 2 weeks where, I anticipate there's going to be lots and lots of questions around mental health crisis, particularly, given the state that we are currently in. And I wanted to really just flag with you that we are going to have a dedicated hour to really explore what mental health crisis is and how we can respond to it in a couple of weeks' time. So the team will be posting a link in the chat that you're able to click to register for that one. But today we're really going to be focusing on mental health problems. So a mental health problem is, of course, the 3 criteria that we spoke about just before. And when those things go on, help is important. But what makes it a mental health problem is when there's no current risk to the person experiencing the mental health problem has no current risk to themselves or to anybody else. The way we know if a mental health crisis is going on is when there is a level of risk either to oneself or to another person. And when there's a mental health crisis, urgent support is required due to that risk. So the reason that we've broken things up this way is because the way obviously we then respond to each of these things is different. So our focus for today is on mental health problems. And if we get, some questions around mental health crisis and whatnot, more than likely what we will do is flag that for something to come for you to bring back up in our mental health crisis webinar in a couple of weeks' time, unless, of course, we get no questions whatsoever about mental health problems, and then we can certainly jump onto that. So before we get right into things, we are talking about responding to people with mental health problems, and it's really important to consider some of the different reasons why people may not seek help. Because of course, if everybody sought help every time they experienced a mental health problem, there probably wouldn't be such an importance on us responding to people when a mental health problem arises for them. However, as many of us know, there are lots and lots of reasons that might get in the way for people seeking help. Some of those could be a self-perception of embarrassment. So some people might not feel comfortable talking to somebody about what's going on, whether or not that comes from other people around them or not. So I do work with a lot of families where they say, I can't believe my son, daughter, partner didn't tell me that they were going through mental health problems. I would have been so supportive of it. And in fact, what's really important to note is the person's own self-perception of the opinions or views or capacity of others to help. There can also be a lack of surety around who to talk to, how to access support, will it even work, and some concerns around the cost, the travel, the accessibility, and the wait times. So this probably isn't going to be new information for anybody here, but I think we do need to acknowledge that there are often a lot of barriers for people seeking help. And one of the reasons I bring this up is because often when we think about responding to people with mental health problems, we think, right, I've got to engage them with a professional. That is the task, that is the job. And often, if that can happen, that is amazing. But what we do know for a lot of people is if we can even chip away at some of the barriers that exist for them to seek help, that can be a major, major change in that person's life. So another thing to consider before we get into the thick of things is we really need to think about what is our role at the time that we are responding to somebody with a mental health problem. So we all take on different roles in our life, and indeed within a day we might play 5 or 6 different roles. So I think homeschooling is a brilliant example of that, where for a lot of parents, they're quite quickly and quite fluidly having to move between, like a teacher role and a parenting role, and how they might respond in each of those roles might be a little bit different. So it's really important to think about what is our role, because that's going to inform how we respond. Another example of that might be that, in one aspect of my life, I work as a counsellor. And so, of course, as a counsellor, when I'm working, the way in which, what my role is, how I might respond to people might be very, very different than if it was a friend or family member of mine. So if it was a friend or a family member, I might be thinking more about how to, encourage them to link in with some other supports. Whereas in my role as a counsellor, or indeed someone who is in the role of a teacher or support staff, might take a bit more of an active role in that response they have to people's mental health problems. In addition to that, different jobs, different roles, there are different responsibilities, obligations, reporting requirements that go on in each of these roles. So really, really important to be aware of that, and how that again, will often be something that can change from time to time. But regardless of what our role is, I think one of the most important messages that I want you guys to walk away from this with is that your support is very important, and that you have an opportunity to be a positive role model. So regardless of what your role is, you might be scratching your head at times thinking, oh gee, is this my role to be checking in with them, or is it someone else's role? Or should I ask that, or should I say that? And I think that the question to that, instead of should I, is can I? So rather than, oh, should I do this? Should I not? Can I do this? And if the answer to that can question is yes, my strong advice would be to go for it. Often we know that mental health is a tough topic to talk about. So if you can talk about it with someone, if you can recognize some symptoms of mental struggle in people, if you can do that, then I think, yeah, you should bring it up with them and start that conversation. I'm going to go through, okay, so I was going to call this the roadmap of how to respond to mental health problems, but the word roadmap has become very tainted since Sunday. So instead, I'm going to say these are the 3 points that I've come up with around how we can respond to people who we think may have a mental health problem. We're not going to use the word roadmap. That word has been taken out of our lexicon at the moment. So the 3 steps that we're really going to be focusing on here is, number 1, noticing and acknowledging the signs of a mental health problem. So we're going to go through those briefly, but really the key part of this is being aware of what those signs are, and then secondly, having a think about how you would go about acknowledging it with the person that you're noticing these signs with. The second step is, beautiful, you've noticed that something's not quite right. You've approached them and brought up the conversation. Then you go, oh my God, what do I do now? So that's when step 2 comes in. And the real focus of this step is listening, validating, showing support, using all of your wonderful social skills, human skills, to just be present, just listen, and find out more about what's going on. After you've done that, the third step is encouraging the person to access support. So towards the end of this presentation, we're going to think quite big picture about support. I think everybody often thinks, oh, support is mental health clinician, mental health professional. Absolutely, that can be great support to link people in with. But I think the other great thing to acknowledge is there are lots and lots of different supports in addition to a mental health professional that can in fact be really, really useful for people. Okay, so what we're not going to do today is go through the DSM, which lists every mental health disorder known to us. We're not going to do that today. What I've made a list of here is a collection of, what's that, 3, 6, 9, 9 plus 4, come on Anthony, 13 symptoms, 13 signs that somebody might be struggling with their mental health. So regardless of, what I really don't want you guys to get bogged down in is going, oh, is it depression that's going on, or is it anxiety, or is it depression and anxiety? I don't want you guys even worrying about that aspect of things, okay? All we're really looking at here is noticing what might be a sign that someone isn't coping well. Okay, so this collection of signs basically move through almost every mental health problem that we work with, that people experience. Of course, you know, there are some more to it, but pervasively this really encapsulates most of what goes on. So what we've got here, I'm just going to step through them with you. One is around feeling sad or down. Now, of course, feeling sad is a very normal human emotion, but what I want you to think back to is the ABCs of what a mental health problem is. Okay, so we're looking for, has this been a change in the usual thoughts, feelings, behaviours of that person? Has it been going on longer than what we would expect it to, and has that change affected their life? So those 3 steps are what you're always going to be asking yourself. Yeah, it's completely, just because you're feeling sad doesn't mean that you have a mental health problem. So I need you to look at these signs in relation to those 3 things that make up a mental health problem. Confused thinking or reduced ability to concentrate, excessive fears or worries or extreme feelings of guilt, extreme mood changes from highs to lows to highs, withdrawal from friends, from activities, from the things that we enjoy doing, significant tiredness, low energy, problems sleeping. This next one, detachment from reality, paranoia, hallucinations. We're really thinking here, you know, some examples of this might include, you know, seeing things that aren't there, hearing voices maybe that aren't there, having some beliefs that, you know, people are following you, assuming no one's following you. That's always an important caveat to put on it. But you know, having beliefs that maybe another common one might be something like people are out to get you, people are trying to harm you in some way. So what the key thing here is that there is a detachment from reality. So of course, if that is the reality of your life, that is not, you know, a symptom. But for people who are experiencing these things in a way that you know, is not considered culturally appropriate, that is not considered useful, helpful, that is causing them distress, then we might consider that might be maybe a sign of a mental health problem. An inability to cope with daily problems or stress. So, you know, often almost like a sense of overwhelmingness about, you know, the things that are going on. Trouble understanding and relating to situations and to people. So I suppose, you know, that's quite broad, but what we're really looking at here is, you know, difficulties with connecting to people, difficulties, you know, understanding maybe what's going on around you, what other people are experiencing and feeling, what you're experiencing and feeling. So, you know, some people, for example, can disassociate from their experience. You know, which is where they become unaware and completely cut off from, you know, any experiences, emotions, or things happening around them. Problems with alcohol or drug use, major changes in eating habits, excessive anger, hostility, or violence, and suicidal thinking. So this last one here, suicidal thinking, is a good example of something that we might consider to be a mental health crisis. So, you know, if you're interested in learning a little bit more about how to respond to people who are thinking about suicide, or who are thinking about or have harmed themselves, I would strongly recommend that you join us for our mental health crisis webinar. Okay, so these are some of the signs, some of the symptoms that somebody might be struggling. Are there more? Absolutely. If you have your head around this collection of 13, I think you're well on your way at being a fantastic responder to mental health problems. So I want you to think about these, try get your head around these. And then once you've noticed it, once you've noticed that one or indeed sometimes multiple, many of those things are going on for somebody, now it's about the approach. So the approach is about how we have the initial conversation with somebody about how they're going. Now, of course, picking our moment is absolutely important here. So with regards to in regards to a mental health problem, we're talking about problems where the person is not at risk to themselves and not at risk to someone else. So because urgent response is not required, we have a little bit of extra time to sort of plan out or have a think about how we might want to approach. So we might think about things like who is around, what are they doing at the time? Yeah, so, you know, if you're wanting to have a conversation about a colleague's mental health, and you know, you walk into their office and you can visibly see that they're like, you know, on their keyboard, is that going to be the best time to have a talk with them about their mental health? I'm not so sure. I'm not sure that they would be completely open to having that conversation with you, even if there was something going on. If someone's in a rush, for example, off to do something else, are they really going to be that open to having a conversation about their mental health, sort of really quickly and whatnot? I'm not so sure. So thinking about what setting you're in as well. Are you in the workplace? Are you at home? Are there other people around? Just thinking about and using your judgment to consider when you think this person might be most open to having these conversations. And I say about how they are really going. So I think we're all pretty used to asking someone, how are you? And people say, good, thanks, how are you? Without even actually thinking about how they're really going. And so I highlight that word, how they're really going, because often for a lot of people, we actually do have to probe much more to find out what's really going on. The key message of this is, again, I don't want you to get too bogged down in, should I approach? Shouldn't I? Is this the perfect time to approach, or is it not perfect? I think most people that have had conversations about mental health would say, about someone else's mental health, would say that, there's never often a perfect moment, but in fact, it's just about making a decision, of avoiding some really terrible times. Again, key learning that I want you to take from this slide: all approaches are better than no approach at all. All approaches are better than no approach at all. So however you choose to do it, if you notice something is going on, make the approach. I make a slide here just to think about considering risk. Now, I feel like sometimes we say risk, and that's very much a term that people in mental health will throw around a lot. I want to unpack a little bit for you what risk means. So when we talk about risk, we are talking about the risk that somebody might pose to themselves. So basically what I mean by that is someone who is at risk to themselves is somebody who either considers behaviour or does engage in behaviour that is harmful to themselves. Now, the spectrum of that is very, very wide. That could be, something from problematic drinking to self-harming to pulling hair out. The spectrum here is quite wide, but what we're really talking about is if the person is either thinking about or engaging in behaviour that is harmful to themselves. The other side of that coin is risk of harm to others. So what we're looking at here is, does this person consider or engage in behaviour that could be harmful to other people? I think a good example of that might be something like violence. So people who consider using or do use violence could be an example of somebody who falls into this category. So when I say consider risk, it sounds very nice, tied up in a bow, that earlier I said to you, so if it's a mental health problem and this person is not at risk, this is what you do. But if it's a mental health crisis and this person is at risk, they require urgent care, and the other things that you can do are going to be explored in this webinar in 2 weeks' time. But of course, there needs to be, often we need to actually inquire and ask and try and identify whether risk is present. So I think the questions about risk are going to be much better answered in our next webinar, but I think it's important to notice that even if we don't think somebody is considering harming themselves, that we should consider either directly or indirectly asking and inquiring about that. So an example of a direct question might be, Some people that that are feeling really flattened down, you know, like yourself, have thoughts about hurting themselves. Have those thoughts ever come up for you? That would be a really direct way of asking that question to identify if risk to self might be present. A more indirect way of asking that might be something like, you know, so when you're really struggling with this stuff that's going on, what thoughts or ideas come up for you? Now, in terms of trying to identify whether somebody is at risk to themselves or to someone else, you know, a direct question is always going to give you much better information than an indirect question. But I do recognise that, you know, a lot of times it can be, especially if you're not used to having conversations with people about their mental health, sometimes it takes a little bit of working up to be able to ask a direct question like that first one. So what you might do is ease into it with that second question, especially if the person, you know, that you're having the conversation with is a little bit more withdrawn. You might start by easing in with a question like the second one, and then moving forward, you know, getting a little bit more specific and a little bit more direct. So yeah, I've just said at the bottom here, this stuff is going to be covered much more in our mental health crisis webinar. But I did just want to mention it, as it's important for us to ask about it, even if we don't think that that someone might be at risk. It is important for us to always have risk at front of mind when we're approaching somebody about their mental health. Okay, so we have done the step one, which is that we've noticed the signs, we have approached them about, you know, the issue and what we've seen coming up. Now the next bit is for us to take the back seat, to sit back, listen, and shut up. So often at this point, you know, we might be feeling really anxious, really escalated, really uncomfortable. And what that often gets us doing is talk, wanting to fix the problem, wanting to offer 50 million solutions. There will be a time to offer 50 million solutions, but what we really need to do is take a seat back and really listen to what the person has to tell us about what could be going on for them. So some of the skills that we can implement here is just observing what's going on, just noticing, listening to what they're saying, attending through our behavior. So what I mean by that is thinking about our eye contact. Do we want to be making eye contact with them? Or might we notice that eye contact is very uncomfortable for that person, and so we do not make eye contact with them? So attending, what I mean by attending is really taking those cues and working with them and noticing what's going to be working best. Thinking about your body language. So are you nodding? Are you facing the person, or are you not? Because maybe if the two of you are facing each other, that might feel really intimidating. So maybe it's that you're, you know, sort of standing, sitting, walking side by side, where you're not having to look directly at each other, but you can still have a conversation. Thinking about your facial expression, right? Are they seeing the panic across your face while you're going, oh my God, 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 I'm going to have to respond to this person's, you know, mental health problem? Are you communicating with your face that you can hold and that you can manage what they're about to tell you? Because if your face is not communicating that, you're probably not going to get the full story. So does that mean that you have to actually feel okay holding all of that? Absolutely not. You know, we're big believers in fake it till you make it. So, you know, I can even say, sometimes for myself, if people are telling me about, you know, some really big things that are going on, it would be really normal for me to have, you know, a little bit of anxiety in my tummy or some butterflies or something like that. It's never comfortable to hear about someone who isn't coping, who isn't going well, but that's okay. It's okay to feel that way. What you don't want to do is communicate to that person outwardly that you're not okay and that you're not able to hold what they're saying. Often sharing simple observations is better than, sort of really probing questions. I tend to think one of the best things to do is, just pick up on, 1 to 2 words that they've said in their sentence and just reflecting that back. So if they say, yeah, I'm struggling at the moment, you might go, yeah. Things are a bit of a struggle at the moment. And often, they might then come back and elaborate a little bit further, and they might say, yeah, school's been really stressful. And you might say, right, so, even school's been really tough at the moment. Really simple observations, often just grabbing a couple keywords from the sentence they've given you. This is going to be much, much better than, well, why are you feeling like that? What's going on? What's happening there? Why didn't you do this? Why didn't you say that when that came up? Okay, so we want to pull back from that. Remember, step 2 is listen, validate, show support. We don't show support by problem solving. We don't show support yet by telling them what they need to do and where they need to go. We're just listening. We're just getting the story. We're just finding out about what's going on. And in fact, that in and of itself can be a really important process, because chances are you're going to have a little bit of a better relationship, regardless of how you know this person. You're going to have a little bit of a better relationship with them than whatever mental health professional they possibly go and see down the track. So if they can get used to talking to you about some really uncomfortable things with their mental health that maybe they've never spoken about to anyone else, that experience of being able to talk about these things is probably going to serve them much better if they choose to eventually link in with a mental health professional. So, you're probably going to be someone that they know, someone that they feel a level of comfort with, at least perhaps a little bit more comfortable than a mental health professional they've never met before. And so just listening, just being there, just letting them tell their story is really important. I would say as well, avoid jumping to corrections, enforcing rules, being right. I can think of a situation, this is, I guess, between a parent and a young person, where a young person was talking to, opened up and was talking to their mother about, some of their anxiety and worry. And they were saying, I didn't hand my assignment in on time, and I was just feeling so anxious about going to school the next day. I couldn't get out of bed, and then mum's jumped in and said, hold on, what do you mean? What do you mean you handed your assignment in late? And of course, that makes a lot of sense. As a parent or a carer, you probably, I would endeavour to say, you're probably going to want, your young person to be handing assignments in on time, but that conversation can come much later. What we're really wanting to focus on here is just giving them the space to talk about their mental health, because in the big scheme of things, their mental health, their safety, their well-being is going to be, much more important than a year 7 assignment. And of course, I think logically all of us know that, but it's about in the moment, being able to pull ourselves up and remind ourselves of that, because I think most of us, myself included, we would all, logically, in a situation like this, we would go, oh yes, that makes sense, and blah blah blah. But it's really about making sure that we pull ourselves up in the moment. Okay, step 3. So we have identified the signs, we have made the approach, we have listened, we have gotten the story. Now is the point that most people probably jump to almost even too quickly sometimes. They don't often spend enough time listening and sitting with, and sometimes just jump to, putting supports in place. So really what we're looking at here is encouraging the person to access supports. Now, the reason I say encourage is because if the person is not at immediate risk to themselves or somebody else, the best we can really do is encourage and support them to access support them to access supports. That is often all we can really do. Of course, if the person is in crisis, we wouldn't be encouraging. We would often just be making sure those supports are put in place. even sometimes against that person's wishes, if that's what's required to keep them safe. So again, that's something that we're going to talk more about in our Responding to Mental Health Crisis webinar, but I just wanted to highlight why I'm saying encourage here. So what can support include? It can include talking with friends and family. It can include, but also noting this is what support can include. It doesn't mean that it will include it. So, you know, for a lot of people, talking to family about their mental health difficulties might not at all be supporting for them. So, you know, it is really about thinking about what's going on for the person. Supports can include, if you know, schoolwork and homework and assessments are a big source of stress, it could be involving the school and having some conversations with them around what supports can be put in place there. It could be seeing a mental health professional. So, you know, we do know that seeing a counsellor or a psychologist or a social worker, you know, or a range of other mental health workers can be really, really useful. It might include providing information, resources, apps, websites. It might include talking about some self-care strategies. I have a bit of a hang up about self-care strategies though. It's important that the self-care strategies that we talk to someone about would be things that they would find self-care. So it's not about saying to someone, oh, you should do this. This is going to make you feel great. Self-care is about what are the things that they're going to A, feel able to put in place, B, enjoy putting in place, and C, will actually provide them some support in this time. Sometimes, you know, I'll speak for myself, particularly through COVID. One of my biggest frustrations, I think, is getting sent 50 million self-care strategies, and I just go, oh my God, that makes me feel even more overwhelmed than maybe what I was before, because, you know, maybe I'm not feeling like I've got the time to put those things in place. Maybe I'm not feeling like those things would really work for me, or maybe I might feel like putting some of those things in place might just be another task to add to a list that's already very long. So just being really mindful about self-care strategies. Improving exercise, nutrition and sleep can also be really good supports. And I think that, you know, if that is something that we recommend, I think it's really important to be clear around why we're suggesting that. So we're certainly not suggesting that somebody is experiencing a mental health problem because they're not eating well. Okay, that would not be true. That would not be accurate. But what we might say is that, you know, because you are, you know, you've said to me that you're feeling really flat and really low on energy. And something that can be helpful for people that are feeling that way, you know, is to be focusing on eating some foods or, you know, focusing on nutrition that's going to be able to give them more energy, for example. Information about services available. So, you know, letting people know who's who in the zoo, who can do what services are available, say for mental health support, or, you know, specific support, maybe domestic violence support, and, you know, a range of other services as well that maybe work in more specific areas. And of course, emotional support. So, you know, again, if we think back to step 2 of just listening, validating, sitting with, that can often be really helpful too. What I would say about encouraging supports is that often giving support feels great for the helper. You know, often we love putting things into place and going, oh, you can do this and you can do this and you can do this. I think one thing that's really important is that we don't let that feeling of us feeling useful and feeling good get us giving 50 million different strategies, get us, you know, I call it menu giving, which is sort of saying, oh, you can, you know, for an entree, you can do this and this and this, and for a main, you can do this, 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 for dessert, we've got this, 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 this. Often for people who are really struggling, that can feel really overwhelming. And sometimes, you know, I've certainly seen it happen with a lot of people where, you know, maybe they get engaged with maybe 3 different services or 3 different supports. That then means 3 different appointments every week, and that actually has almost a backfiring effect of the person just getting exhausted about support. So just being mindful of that as well. Who are some professionals that can help? There are some here. This list is not exhaustive. I can already see that social worker would be one that's not listed here, that a lot of people would see for support. Basically, all of these professionals might do very sort of specific things. So, for example, GPs and psychiatrists are, medical doctors by trade. However, some of them will provide some mental health supports and things as well. Psychologists, counsellors, mental health nurses, social workers, depending on the person's training and interest, they could all be essentially doing the exact same work, or they might be doing, very, very different work. Even within our own team of counselling at Wyndham, we have some people that come from a psychology background, we have some people that come from a counselling background, and we've even had, some other people in the past that have had social work backgrounds. So what I would really recommend here is, in terms of identifying what support would be most useful, is picking up the phone and having a chat with people. If there's a particular psychologist that you think would be great to work with, I really recommend picking up the phone, giving them a call, having a chat with them about what's going on for you and how it is that they work. Because that could be almost identical to how another counsellor works, or it could be worlds apart because maybe they use different approaches and different therapies. So what I would say here is, in terms of, should I go see a psychologist, should I go see a counsellor, a mental health nurse, a social worker, and a mental health occupational therapist? Often a lot of these people can be doing very similar work. So best thing to do, I think, is always have the conversation. Just like you would shop around for any other service that you wanted to bring in. If you were looking at getting some renovations done at home, you might get a few different quotes before you decide who to commit with. Do similar with your mental health support. Have a shop around. Maybe talk to some friends around, is there someone they would recommend or they've heard of, or, that they've had positive or had a positive experience with, or heard positive things about. Really, really important. And I think the last thing would be, just because you meet with one counsellor maybe and don't connect with them, it doesn't mean that you're not going to not connect with all counsellors. Equally, just because you have a positive experience with a mental health nurse does not mean that you're not also going to have a positive experience with someone else that works in mental health. What if people don't want help? So, in the context of mental health problems, be prepared to talk again in the future. Remain positive about professional help. If things do escalate, you might need, if things escalate, say, to crisis point, you may need to act against their wishes. And again, that's something that we'll be talking about, in our mental health crisis webinar. But just also note, don't threaten, lecture, nag, or use guilt. Just maintain a good relationship. So you want that person to feel comfortable to come back and talk to you in the future. Pushing them further than they're ready to go is not going to be helpful in this case. I do like to put this slide in around considering culture and diversity. So we do know that some groups in our community are at higher risk of mental health problems than others. And this is often due to a range of factors, specifically including discrimination, intergenerational trauma, racism, homophobia, accessibility to services, and many, many other things. The first thing I would say is always remain curious to all people that you come into contact with. So, be really clear that you're not going to be able to look at somebody and automatically identify what their diversity profile is. So what groups they're a part of or not a part of, or identify with or don't identify with. So we always want to be curious about all of the above. Anyone could identify with a lot of these groups, and we don't want to make assumptions about what those people might need or want, or think or feel based on what we think their diversity profile is. Even sometimes when they might tell us and they might say, I'm of this religion, I identify with this sexual orientation, again, we still don't want to make assumptions about what we think they might need or want. Consider that some people might feel more comfortable or less comfortable with a service that specialises in their diversity profile. So, for example, perhaps someone who identifies as part of the LGBTIQA+ community might actually feel a little bit less comfortable going to a service that specifically works with the rainbow community, because maybe if someone found out they were going there, that might be a bit revealing about their diversity profile, if they perhaps weren't comfortable with that. And if there is hesitation to accessing a mental health service, just be curious around why that might be. So as always, as we would with anybody, regardless of diversity and culture, provide relevant options and be guided by the person that you are responding to. At this point, I might stop sharing the slides and just see if there are questions that people might have answers to. I'm also happy to stay a little bit, I don't know if there are questions, but if there are, I'm happy to stay a little bit past 7:30.
Yeah, okay, and we haven't had any questions at this point that hasn't been answered, but I wonder if anyone does have any direct questions for myself or Anthony, please feel free to write them in now so we can address them.
Beautiful.
Yeah. It's been great, Anne. It's been a great presentation. I think it's really great to be able to focus on how to respond, because often we can get a little bit stuck when we see our loved ones or people around us who are experiencing mental health problems, and just to be reminded about how to listen and be attentive and supportive is really important. So, yeah, thanks for this presentation tonight. I don't think there's any questions, Anne. I'm wondering if there's any final thoughts that you'd like to share before we finish?
Yeah, I think, I guess the only thing that's crossing my mind would just be around the fact that this presentation, in addition to a lot of our other presentations, we've got recordings of those online as well. So, feel free to go back and look over this. I certainly don't expect everybody to remember, a full hour's worth of content. But what we do hear from a lot of parents is that after our presentations, Tanya has said in the Q&A that, we will be emailing out the recording when it's available. Do feel free to go back and re-listen to it. It is a lot of information that we pack into an hour, but we're also mindful that, staring at a screen for over an hour can often be quite tricky. So just to feel free to come back to this whenever, you'd like to, just to review any of the things we've discussed.
Yeah, that's great. And also Tanya has noted that we will be sending out in the email as well, just a list of mental health support services that you can access. So I think we could probably finish there. If there are no other questions. If you feel like you'd like to ask some questions privately, please send us an email to youthcounselling@wyndham.vic.gov.au, and we're more than happy to chat to you around any concerns that you may have of anybody that's close to you. And we can discuss even just individually how, perhaps you could support that person to get the support they need. Because we understand that sometimes it can be quite tricky to have those conversations. I think that's pretty much it. I think thank you everyone.
Rosie, we've just had someone. We've just had a few things come through the chat in the last few seconds, and someone's just asked that we wait.
Sorry, what was that, Tanya, that we wait? Oh, right, yes, just to respond to this question, cost can be a problem for some. Yeah, so it really does depend on the services out there. We do acknowledge that there are some, the mental health care plan is available for community members. And we know that for young people, there are free services for counselling. So just to be aware that through council, the generalist youth service counselling is free up to 10 sessions. And there's Headspace as well that also offer the bulk billing option for young people. Was there anything you wanted to mention, Anth, in terms of the service system and around all that?
Yeah, I think it can often be really tricky around cost as well. And, you know, we're in a very interesting time at the moment because there are lots of state and federal government reviews into mental health. So, you know, I also think that we're all very interested to wait and see what findings, you know, they come back with, if, you know, there is going to be, you know, extensions on mental health care plans for 20 sessions instead of 10 and whatnot. But, you know, very much agree that cost can be a problem for a lot of people. And, you know, hopefully, you know, moving forward, that's something that does get addressed, you know, much more.
Yeah. So, yeah, okay. There's just a comment here. I was hoping to get some advice on how to balance the individuality versus the need to obey rules.
Yeah, I'm wondering about how to balance the individuality versus the need to obey rules. I'm wondering, yeah, I'm wondering if maybe the person that's written that might be able to give us a little bit more information about that. I think
yeah.
A little bit more information's just come through is the last comment, Anthony.
Oh, lovely.
Do you want me to read that, or you're right, you can read that, Anthony? So it says, my son who is 9 tends to get these confused and I'm stuck for ideas on how to balance the notion to being an individual and being compliant to rules at home, at school and with parents.
Yeah, well, you know, very interestingly, I think that's actually the big battle for teenagers in development, isn't it? You know, we actually see that, I think, play out across the board, and in fact is one of the biggest developmental milestones for teens, which is, I'm not going to be like, you know, they go from children where it's all about everyone being the same and, you know, everyone is the same, and all of a sudden then it's really about being an individual and trying to navigate how to be an individual, but also, you know, not going to a point of, you know, as you've said, you know, breaking rules and, you know, going beyond sort of what's okay and what's safe. And so I think that, you know, while I guess we sort of haven't really explicitly been talking about parenting today, I think something that's always a good rule of thumb is curiosity. You know, when we see a behaviour play out that we just think, you know, what was that? You know, that completely breaks the rules, or that goes right against, you know, what I'd be hoping to see or expecting to see. You know, getting really curious around what, you know, why is it, do we think that that particular behaviour was shown or that limit was pushed? You know, is that their way of communicating to me that maybe they're wanting more responsibility? You know, and we can sort of wonder about that, but also even ask. You know, I'm just mindful of, you know, 9 years old, and so really sort of maybe asking, you know, what it is that might be underpinning, you know, not following the rules. Is it wanting to fit in, or you know, just kind of, well, no, I disagree with the rule. And of course, how we might respond in each of those situations might be a little bit different.
Yeah. So there's another comment here. I'm at the stage of maintaining a good relationship with teenager, but hope that this is not seen as not caring.
Yeah, so I guess I'm sort of thinking out aloud around, you know, what maintaining a good relationship looks like. And I'm wondering also from whose perspective. So, you know, sometimes we can often think, you know, what we might think is maintaining a good relationship with someone may not be understood and seen by the other person as maintaining a good relationship. And so I think that what can be really useful is, you know, if we come back to that idea of curiosity, is if we are trying to maintain relationships with, or maintain good relationships, I suppose I should say, is I think we would need to, it would be really interesting to have a conversation with our teenagers to say, hey, so what would a good relationship between us look like? Because potentially if me as a parent, if my idea of a good relationship is I say do this and it gets done, my guess is that, our teens might feel a little bit differently about that. Our teens, might see a good relationship as, giving them some room to try out different things and to grow in different directions. Whilst slowly releasing the boundaries of what's okay for them to do and whatnot. So, I suppose I don't feel like I've got a lot of information about that, but I'd be really curious just on that to have a think. Just wondering about what is a good relationship. How does each person in the dynamic define what a good relationship is, and how what would that person see me doing, or hear me saying that would help them think that or believe that we had a good relationship.
Yeah, great. That's just some feedback there. It says that that's great. Thank you.
Wonderful.
Yeah, just a few comments here. Excellent, Ant. Always enjoy your presentation, Anthony. So that's really great feedback. Thank you. You can expect an email from us, and we will be requesting some feedback as well. So we would really appreciate some feedback about the presentation and any ideas you have around future webinars that you'd like to hear from us. Please don't hesitate to let us know, and that you'll have that opportunity through the survey link that will be sent to you by email. Look, I think that's it for this evening. Thank you everyone for attending. We've really enjoyed presenting to you tonight, and we hope that it's been informative and helpful, and we encourage you to be in touch if you have any further questions or any kind of wanting some more support individually. Please be in touch. I think that is it for the evening. Thanks again, and look out for our emails to invite you to future sessions, future webinars. Thank you. Have a good evening. Good night.